Hi everyone, today I will be presenting a case presentation response to cellulitis. So AD is a 73-year-old male who came in with pain to his left leg. He reports he typically uses a back scratcher to scratch his legs since he can't reach below due to his obesity. A few days ago he felt some pain to his leg, and today he woke up with redness and difficulty bearing weight on that leg. His symptoms currently are erythema, warmth, swelling, and tenderness to his left leg. He reports his blood sugar this morning was 273, and his sugars have been ranging high these past few days as he has not been able to refill his insulin vial due to insurance issues. His past medical history includes diabetes, asthma, and obesity. AD was noted upon entering the examination room to have impaired mobility and has started to shift most of his weight to his right foot. His vital signs were taking in height. His weight is 311 pounds. Heart rate is 98. Temperature 37.9 Celsius. Respiratory rate 18 and blood pressure 134/68. Pain was rated at a scale of 7/10. His neurological assessment is within normal limits. Cardiovascular assessment indicates he is slightly tachycardic with a low-grade fever suggesting signs of infection. His respiratory assessment indicates he has inspiratory wheezes on bilateral upper lobes. He does report he has been taking his albuterol more frequently. Gastrointestinal assessment indicates positive hyperactive bowel sounds heard throughout. His skin assessment indicates a linear abrasion to his left calf where he reports scratching in the past. The area is edematous with erythema and is warm to touch. There are no other skin breakdowns or abnormalities evident in other places of his body. Based on his presentation and his symptoms, he is presenting with hallmark signs of cellulitis. Cellulitis is a medical condition that presents itself as an acute inflammation of the skin, usually resulting as a result of bacterial infection, and is often seen in the lower limbs. Based on his presentation and reports of using a back scratcher to scratch his legs, it is possible that his cellulitis is due to Staphylococcus bacteria. Furthermore, his poor glycemic control is also associated with development of cellulitis. Cellulitis can typically be diagnosed with a clinical examination. However, if clinical examination alone is inconclusive, then an ultrasound may be performed to improve diagnostic accuracy. Other diagnostic tests that can be ordered are a complete blood count to assess his white blood cell count, blood cultures to identify the type of bacteria causing the cellulitis, and CRP levels to assess inflammatory markers. The CBC, or complete blood count, will indicate he has elevated leukocytes. His blood cultures will come back positive as staph, and his CRP will be elevated, indicating inflammation is present in his body. For mild to moderate cases of cellulitis, oral and parenteral antibiotics are prescribed to cover for streptococci and methicillin, or staph as well. Typical duration of treatment is 5 to 7 days, although this should be extended if there is no clinical improvement. And as you can see below are my references. Thank you everyone for taking this time and listening to my presentation.